Well, today is Thursday, the 31st of May, the last day of May, and I'm glad you've been able to join us again. By the time you hear this or read this, I should just be starting my annual ritual of the full medical at the Mayo Clinic in Rochester, Minnesota. This has been a ritual of mine since 1995, and it's one of those unpleasant things in life that's simply a good idea. It is clear that one of the things that leads to a longer life overall, and all things being equal, is access to proper medical and health care. Add to that a good education, good nutrition, and also, very importantly, access to financial support. That is why the PLP passed a bill before it left office to implement a comprehensive national health insurance program. This insurance would pay for all medical costs from the cradle to the grave, and it would cover all people in the country. Sadly, with the coming of the FNM, that is now to be cancelled, and instead it is to be replaced by as yet an unrevealed program of subsidies for the poor and the aged. They announced in the speech from the throne on Wednesday the 23rd of May that they will begin to subsidize medicines from the public purse. Many of us started to chuckle in the House, because the thing is, medicines are free right now, so we can't quite figure out what this means. All the more reason then why they ought to debate the speech from the throne immediately so we can see what it is they're talking about. While foreign minister, I attended a CARICOM conference at which Sir George Alleyne, the former head of the Pan American Health Organization and now the Chancellor of the University of the West Indies, and of course a distinguished physician himself, reported on a CARICOM-wide health initiative, and this health initiative was commissioned by the heads of government of the Caribbean. And CARICOM, of course, includes the Bahamas. Dr. Alleyne reported that there was a major problem in the CARICOM region with obesity. That means being overweight. And allied to that was the lack of a proper exercise and diet, and a huge jump in adult diabetes and cases of high blood pressure. These diseases rob people of their productive years, and they are entirely preventable with the right nutrition, education, discipline, and money. What is also frightening is the rise of cancer cases in the region, also some people believe associated with nutrition and obesity. Prostate cancer, for example, is a major problem for men, and Americans are saying that in their country 1 in 6 men will get prostate cancer in their lifetimes. For black men, it appears to be even more serious. Since we live the same lifestyle and eat the same foods as the Americans, the region can expect similar issues. In the case of women, the cases of breast cancer are also frightening. From an anecdotal point of view, it appears that every time you turn around, a woman is reporting that she has breast cancer. I know of 2 cases in my own constituency which I discovered during the last campaign. One is a woman who is 27 years old, and the other is a woman who's 35. Both have aggressive tumors. And consider that in one case, the woman has to have 6 applications of chemotherapy at a cost of $2,200 per shot. And then that's to be followed by radiation. Pray tell, how, without insurance, someone of ordinary means will be able to pay for this? National health insurance must come, and the FNM should be ashamed of themselves, a party of rich men who do not care whether the poor people and the working people can take care of themselves, and now they're canceling the national health insurance. So, on a personal level, I would encourage all men to go out and get an annual physical. The public health clinics in Nassau will do them for free or for a nominal charge. They tell us that prostate cancer caught early enough is entirely curable. We, the men of today, should help to ensure that when the little boys of today become our age, prostate cancer is a fear of the past. And the women should make the same vow with breast cancer. Caught early enough, they can really do well in slowing it right down. The PLP is dedicated to the health of this nation. We will continue to hold the FNM's feet to the fire for national health insurance. To let it go would be to miss this political generation's major contribution to the well-being and the future of our people and our country. Well, that's it for today. I hope you can join us the next time, as I wish you good health and you wish me the same.
Actually, that was the DVD, that was the platform just finishing up. That's what that was.